into that in just a moment, but we're also taught that all of these questions are meant to be for a purpose, to have a reason. Yeah. And ultimately, it's to help us begin weighting one of these diagnoses or classifications more than others. Yeah. So in your worse, better section, talk us through what you learned and then help us understand what that means to you.
Okay. So as far as weighting is concerned, one of the first things that occurred to me was it's unusual to have bilateral. Mm-hmm. And sometimes it would be unilateral, sometimes bilateral. And it could be if it was unilateral, it could be the left or it could be the right. It may not be there on the other side. Mm-hmm. So that's one of the first little pieces that I'd squirreled away. Now, his history, I'm sure all of your listeners are familiar with a typical history of someone with plantar fasciitis. Mm. The ones I've seen, they've always been worse in the morning. Mm-hmm. When they get out of bed, those first few steps can be particularly uncomfortable or unpleasant. And then often it eases a bit as they get moving. But then if they sit for any length of time, it normally stiffens up or whatever. But when they go to stand again, they go through a similar process, although it may not be as bad as first thing in the morning. Mm-hmm. Now, this fellow didn't have that. Mm. He was never worse first thing in the morning. Often it was actually, he felt usually quite a good time first thing in the morning. So right away, with just that one thing, you're thinking, wow, that's very atypical of a plantar fasciitis, because normally you'll find that morning is the worst time. The other part was he could not identify anything that would bring on his symptoms at this moment. So normally, one of the great things with seeing an extremity patient is so many of them will have a special test that you can do. You can say to them, what makes you worse? What could you do in this room that would bring on these symptoms? And that's what makes it so much easier to treat extremities, because so many patients have that. This guy didn't have it. Mm-hmm. I can't bring it on if I don't have it. That's unusual as well. So in terms of what did make him worse, he said, if I'm walking for prolonged periods of time, but the interesting thing was, it may not be today, but if he did 3 or 4 days in succession with more walking.
Month after month, new guest experts like Colin Davies presenting actual patient cases like this one and access to all the past. Check out case conversations at mechanicalcareforum.com.